Hello, and welcome to the Department of Drug and Alcohol Program's Warm Handoff Survey full training. This training was updated to include any changes made to the survey prior to March 2024. Any questions about this webinar can be submitted to the resource account that will be given at the end of the webinar. This webinar is on the current Warm Handoff Survey platform that SCAs have been successfully using since April 2020. This webinar was designed internally by DDAP staff as a form of technical assistance to facilitate a smooth transition for the upcoming enhancements for the survey. This training includes full survey instructions that will be useful to any new staff filling out the Warm Handoff survey. This training will review how to download the application to your desktop or mobile device, how to troubleshoot any issues that may occur with the survey application, and how to complete the survey for monthly submission. Now, I will turn over the training to Ralph Beischlein, who provides statistical support for DDAP. Ralph will guide you through download and use of the survey platform.
Thanks, Amy, and my thanks to those watching. I'm going to briefly walk through the DDAP Warm Handoff Survey 123 for ArcGIS form. After the completion of this training session, if you have concerns, please submit your questions to the DDAP resource account provided at the end of the presentation. ArcGIS Survey 123 is an extension of Esri's ArcGIS product line with a survey form focus. DDAP has been using Survey 123 with great success for the past 6 years in completion of the Substance Abuse Block Grants section regarding the annual SINAR survey of tobacco outlets, where we disseminate and collect nearly 2,000 survey forms from field staff each summer. And we are approaching the end of our 4th year of use for monthly Warm Handoff data collection. As a leading company in geographical information systems, Esri is experienced in what they've deemed the science of where. Survey 123 for ArcGIS offers great utility for the collection of information about locations from those accessing and working with those locations. It facilitates reporting about those locations, the development of map visualizations to highlight geographic insight, and utilization of data to inform decisions. To reach that level of analysis and insight with Warm Handoff, we first need a way to quickly and accurately capture information about Warm Handoff encounters occurring within your SCA. The first step in reporting your Warm Handoff via this avenue requires you to download the Survey 123 for ArcGIS field application. This can be found at Esri's Survey 123 project resources site at the URL provided. The Survey 123 for ArcGIS application is free to the public and is used to provide survey forms for respondent completion that have advanced designs that can't simply be completed in a web browser. Most importantly for this collection form, Survey 123 allows DDAP to have an information file populating questions and information based on your responses during completion of the form, and supports a survey structure that allows for a consistent data structure. This makes data aggregation across SCAs a much more streamlined process. When you're looking to download the field application on the Survey 123 download site, make sure you select the field app used for responding to forms and not the Survey 123 Connect app, which is used for designing forms. You will not be able to download and complete forms in the design application of Connect. You only need to download the field application. We recommend completion of the form via the Survey 123 desktop application. However, if you'd like to complete the form on a mobile device or a tablet instead, you can download the application from the App Store of your choice. We understand that SCA IT security policies may require additional time for installation and support if that on-site tech support is necessary to complete the process. Here we show the first screen when opening the ArcGIS Survey 123 field application. The Warm Handoff forms are designed to have public level access. This means that they do not require a login to track respondents. You should never have to enter a username and password. Despite not being stylized as a button by Esri, you can click the button Continue Without Signing In to bypass this login screen, and you'll reach the My Survey 123 landing page. If you have not previously downloaded a Warm Handoff form or another form to your device, you may see this noted on the My Survey 123 landing page. Additionally, depending on your device permissions, you may receive a warning that your location is inaccessible. This is more important for forms where the location of the respondent is critical information, but for warm handoff purposes here, you can simply click Close to dismiss this warning and proceed.
Thank you, Ralph, for the walkthrough of how to properly download the survey app. Failure to complete the download of the survey app will result in your inability to complete your monthly survey. Next, Ralph will review how to access and complete the actual survey form.
Thanks, Amy. Dissemination of the survey form has continued to be an evolving process. Currently, DDEP sends a monthly email to the SCA administrator mailing list describing 4 avenues of access via survey links. The first 2 options involve a direct application call to the ArcGIS Survey 123 application, one from a direct link in the email, and the second via copy and paste of that call into a web browser. This method is the most direct, but is also the most likely to be flagged by IT security policy. The third option includes a more standard URL that can be clicked. Once at the resulting page, the respondent can click the Open the Survey button after they have the ArcGIS Survey 123 application installed on their device. With any of these 3 routes, you may receive a pop-up message asking to allow the link to open the field application, and you should permit this. The fourth access option involves accessing the form directly through the Survey 123 field app by searching for the standard URL from the My Survey 123 landing page. Accessing the form through any of the 4 methods will download the survey form and the background data to your device and place you at the beginning of a new data entry response for the month. If you do not wish to work on your data submission at that time, you can close the response and the form will be available on your My Survey 123 landing page on your device. If you've already downloaded the survey for the month for completion at a later time, you can navigate to the survey in the My Survey section of the Survey 123 field application, select the survey to go to its form navigation area, and then select the collect option. If accessing forms from the My Survey 123 page, please confirm you've selected the correct month's form. The lower image shows a single form's navigation screen and its possible navigation options for collecting a new form, editing draft forms in progress, accessing forms in the outbox waiting to be sent, and viewing previously submitted forms. When ready to complete your warm handoff data submission, click through your route of access, bypassing any login and location access issues as mentioned previously. When completing the form, you'll be asked a series of questions. Some may require you to select your response from a dropdown, make a selection from a list of options provided, or you may be required to type a response. Your responses to questions may cause further questions to appear. The form responds to your answers in real time. Questions requiring a response are denoted with a red asterisk within the field application. Most questions on this form are required. Start by selecting your SCA from the drop-down list. This selection populates information on the form for your SCA that was initially provided in collaboration between DDAP and the Pennsylvania Department of Health Division of Acute and Ambulatory Care, and further refined through clarifications, additions, and removals for hospitals, listed within emergency department, which you may see abbreviated as ED throughout the form. The date will automatically populate and is set to a read-only status, so you will be unable to change it. This value changes each month as I produce the latest form, so please verify you are reporting data for the correct period when completing the form. When entering the information for the contact person, provide the name and phone number of the person to be contacted regarding questions directly related to the survey. Having the correct contact facilitates the process should questions or concerns arise related to SEA responses. The form verifies that a 10-digit phone number has been entered and that the email address follows a valid email format, that it includes the @ sign and a period followed by 2 to 4 letters. Please also make note of the provided definition of a warm handoff here. With the impact of COVID and continued review of warm handoff processes, this definition has continued to adapt to reflect the efforts of the warm handoff community. Specifically, warm handoffs are no longer required to be face-to-face encounters, nor are they limited to only door-to-door referrals. This latter change reflects a change in response to SCA communication requesting more recognition for referrals into various treatment services that weren't necessarily door-to-door. These referrals are just as valid and just as critical as their door-to-door counterparts towards recovery. Selecting your SCA causes the section entitled Hospital Information to populate with information from the curated facility list regarding the count of hospitals, the hospital names, the hospital addresses, determined by the county of the hospital. In this image, I've chosen Beaver as my SCA. The data behind the survey identifies that there is a single, one hospital in this SCA, and pulls in the name and address of the hospital, as well as the latest reported models and shifts of warm handoff occurring at that facility. Please always review this information and note any changes in the comments at the end of the form. New hospital facilities will have shifts and models denoted as not yet reported to DDAP if this information is not provided for inclusion when the hospital is first added. If not provided, you'll be prompted with questions regarding the warm handoff models and shifts available. The SCA must then indicate whether warm handoff encounters occurred anywhere in the hospital, within the ED or outside the ED. Please note that clicking the downward-facing triangle left of hospital information will collapse this section of questions. You do not want to have this section collapsed. So if you do collapse it in accident, click the arrow again to expand the question once more. Throughout the survey, definitions and examples are provided alongside relevant questions to reduce misinterpretation and add clarity. You can see the warm handoff again defined, as well as a warm handoff encounter here on the first hospital question. Indicating that warm handoff encounters were conducted prompts additional questions regarding those warm handoff encounters. If warm handoff was conducted at a hospital, it is necessary to report the total number of warm handoff encounters within the hospital's emergency department. DDAP requests how many of the encounters were conducted via telephone without any face-to-face interaction, even if digital, and done so for any reason, not just due to COVID concerns. There are validation checks in place that will prevent the number of telephone encounters from exceeding the number of encounters reported. You are then asked for detailed counts of the outcome of the reported encounters. What was the number of warm handoff encounters that were successful, and what numbers resulted in referral, as well as those that result in refusal. The previously utilized incomplete warm handoff status has been removed. Referrals and refusals are defined with their relevant question. Responses are required, meaning blank responses are not accepted, so please enter 0 where applicable. There is a quick read-only validation check that totals your entered outcome responses of referrals and refusals and verifies that this matches the number of total encounters reported in the ED. If this value differs from the initial number occurring, you cannot submit the form. You must change your number of referrals or refusals and then exit that response value to update and change this validation check. When your total reported count is equal to your detailed outcome count, you can proceed. Your response regarding the count of refusal outcomes may cause additional questions to appear. Reporting any number of refusals prompts a question asking for the reasons for encounters resulting in refusal. You can select any number of reasons, and you can specify other reasons for refusal by selecting Other. Upon doing so, you will be required to provide an explanation. DDAP is interested in knowing what services are receiving referrals. The number of reported referrals is pulled into the question text for the STA's reference. One warm handoff encounter may result in referrals across the categories of services provided: inpatient, outpatient IOP partial, recovery support or case management, and MAT. Increment a category if the encounter resulted in a referral for that category. Since one encounter may result in multiple referrals, some of these categories will likely exceed the reported number of encounters resulting in referral, but a single category here should not exceed the number of encounters resulting in referral. Please note again that the downward-facing triangle will collapse this section of questions. If you collapse it in error, click the triangle again to expand the question group once more. A question regarding the magnitude of referrals to treatment services being delayed for any reason has been added. Report the count of referrals that were delayed, entering 0 if no referrals experienced a delay. Responding that any referrals were delayed causes a series of questions regarding delay reasons to appear. DDAP is interested in assessing treatment capacity, as well as other challenges to the timely access of referred services. The reported number of delayed referrals is pulled into the question text, and validation rules prevent any single category from exceeding that number. Since a single encounter may be delayed for multiple reasons, the sum of these delayed reasons may exceed that reported count of delayed encounters. Responding that some referrals were delayed for other reasons prompts response for an explanation. While originally only responding to opioid overdoses, the Warm Handoff program continues to expand its scope and reach to those in need of its services, including those not experiencing an overdose. DDAP is interested in knowing the number of encounters resulting from situations other than overdose. This question pulls in the total number of encounters reported for its text and validation. A read-only calculation question follows, calculates the number of encounters due to overdose based on your response. Double check that your reported counts are intended and adjust the other than overdose response value if necessary. As drug trends continuously change, DDAP has been collecting data that goes beyond opioids to include other substances. This expansion has been more inclusive and encompassing and provides a mechanism to analyze additional substances involved in warm handoff encounters. The next question series of how many of your warm handoff encounters with this hospital emergency department did you respond to for the following substances is to capture the specific number of warm handoff encounters related to each substance category. Individual substance items used in DDAP reporting and SAMHSA TEDS data have been grouped into larger categories here. Enter the numerical response for the number of encounters for each drug category. If the response is none for that category, then a 0 should be entered. These are required items. Blank values are not accepted for submission. In those instances where an individual may present with polysubstance use across multiple categories, the SCA should count the encounter for all relevant drug categories. Individual category values must be less than or equal to the total number of encounters reported during the period, but because of polysubstance use, the sum of values may exceed that value. Please note once more that the downward-facing triangle will collapse this section of questions. If you collapse it in error, click the triangle again and it will expand the group once more. DDAP is not only interested in warm handoff inside the EDs. DDAP includes questions regarding warm handoffs that occur in each hospital in areas other than the ED in a very similar question track. This question will be prompted for each hospital reporting warm handoff encounters occurring for the month. Within the current hospital were warm handoff encounters conducted in hospital areas other than the ED. This question requires a yes or no response, and an affirmative, again, causes more questions to appear. This question allows an analysis of hospitals with warm handoff engagement throughout other areas of the hospital. For one hospital, warm handoff may only be conducted in the ED. For another of the SCA's hospitals, warm handoff may be done throughout the hospital. Examples of areas other than the ED where warm handoff encounters may be conducted include, but are not limited to, medical or surgical units, labor and delivery units, and behavioral health units. Respondents can identify these areas in the final comments of the form if desired. For hospitals indicating warm handoff outside the ED, questions from the ED line of questioning are mirrored for these expanded warm handoff areas. You'll be asked regarding the total number of encounters, the number of encounters via telephone, and the number of referral outcomes and the number of refusal outcomes. A validation read-only check appears again, as well as a refusal reason question if refusals are reported. The outside the ED question line also mirrors the question item involving reporting a breakdown of treatment services referred to for those successful referrals. Again, increment a category if the encounter resulted in a referral for that category. Since one encounter may result in multiple referrals, the sum of these categories likely exceeds the reported number of encounters resulting in referral, but each category itself should not exceed the value. This is again a collapsible question group. If you collapse it with the triangle button in accident, click it again to expand the group. A question regarding the magnitude of referrals to treatment services being delayed for any reason again follows. Report the count of referrals that were delayed, entering 0 if no referrals experienced a delay. Responding that any referrals were delayed, again, prompts for a series of questions regarding delay reasons to appear. Again, since a single encounter may be delayed for multiple reasons, the sum of these delayed reasons may exceed the reported count of delayed encounters. Responding that some referrals were delayed for other reasons will prompt you for explanation. DDAP prompts for a count of outside the ED encounters resulting from situations other than overdose. This question pulls in the total number of encounters reported for its text and validation, and follows with a read-only calculation based upon that value reported. Double check that your reported counts are intended for other than overdose and overdose values, and adjust the other than overdose value if necessary. Reported substances corresponding to the warm handoff outside the ED continues to be collected. Categories match those presented on the ED question line. If a response is none for a drug category, then a 0 should be entered for these required items. In those cases of polysubstance use, increment all categories involved related to the encounter. Again, the sum of these categories may exceed the count reported, but each individual category should not. This is a collapsible question group with a downward facing triangle. If you accidentally collapse the question group, click triangle again to expand it once more. This completes the set of questions you might encounter for a single hospital. If there are additional hospitals identified as located in your SCA, you will need to navigate to the next hospital record by clicking the right gray arrow within the form, and then continue to indicate if the hospital conducted warm handoff encounters. Here, the image shows 1 of 19 and the arrow to advance to hospital number 2. If you have completed the series of questions for all hospitals in your SCA, you can proceed and add any additional notes and comments in the final field. This is where requests for changes to hospital information that is pre-populated should be noted. For example, the SCA may note the inclusion of an additional hospital in the warm handoff process and provide their name, address, models, and shifts for use and incorporation. Similarly, the SCA may note the closure of a facility. The SCA may communicate a change to the shifts that warm handoff encounters are conducted in a hospital, or that they're utilizing a new model type in addition to those noted in their previous submissions. If edits are noted in this comment field, DDEP and I will follow up with the form contact if necessary, and then make the requested modifications available for the next monthly survey form. Clicking the check mark in the lower right prepares your form for submission. The application will do a final validation check of your responses. Pop-ups for flagged responses may appear, and they will direct you to the survey questions violating validation checks. If all your responses are found to be valid, you will see the survey completed pop-up. The survey completed screen identifies if your device is connected online and able to transfer data. When you are connected and select the option of Send Now in the middle, the data is submitted to DDEP, and a copy of your responses will be saved in the Sent storage area on the collection forms navigation screen within your application on your device. So long as the survey remains on your device, you can review the submitted form with your completed fields by clicking Sent in the collection forms navigation area. Select the Send Later button to send a copy to the Outbox storage area on the collection forms navigation screen. This should be the option used when you have completed the form, but you're not ready to send the completed form yet, such as cases when you have no data connection currently, or you need to confirm and enter a response before submission. Selecting Send Later will not submit the data to DDEP. Instead, the form can be opened from the Outbox and completed later, and then sent via the Send Now button at that time. Essentially, when you are satisfied with your data entry and you are able to submit, be sure to use the Send Now option to send the data to DDEP. If you wish to verify a successful submission of the form, you can email the DDEP resource account and confirm it there.
Thank you, Ralph, for the walkthrough of the Warm Handoff survey. Questions regarding the Warm Handoff survey may be sent to the email resource account. Please include Warm Handoff report in the subject line of all inquiries submitted. Thank you for your time. This now concludes the training.